Integrated medicine is a relatively new approach that combines the best of traditional medicine along with complementary therapies. We are really fortunate in Hilton Head to have Main Street Health Center here, the only integrated center. They use doctors with multiple disciplines who work together for the patient. And one of those doctors joins me now, Dr. Joseph Haven. Great to see you.
Thank you.
Let me ask you, what kinds of health issues do people come in to see you about?
Really everything musculoskeletal. Really starting with headaches, TMJ, neck pain, shoulder pain, elbow, wrist pain, carpal tunnel syndrome, low back pain, sciatica, knees, hips, ankles. We even do custom orthotics.
Can I ask you to give a better definition than I did as far as what integrated medicine is?
Sure. Integrated medicine is the utilization of multiple healthcare disciplines combining in one location.
When you look at the approach of traditional medicine versus integrated medicine, how do they differ?
Well, 80%, statistically 80% of patients with musculoskeletal conditions are going to go to their general practitioner first. And most general practitioners will admit that these represent the worst and most complicated patients for them. And why is that? Most GPs do not have a massage therapist, they don't have an acupuncturist, they don't have a physical therapist, they don't have a chiropractor, and most of them don't do trigger point injections or joint injections. So for them, these patients represent a case or condition that they really can't do anything with immediately. So what they typically do is give prescriptions for muscle relaxers or anti-inflammatories or painkillers, and then usually either have the patient come back in a few weeks or refer them out to somebody else. And at that point, they get referred out to an orthopedist maybe, or a neurologist for an MRI or for x-rays. Maybe they're sent to physical therapy, or maybe they're sent to a chiropractor or an acupuncturist. But you can see how arbitrary all this is. What we do here is we combine the best of all of those disciplines in one location.
For the patient, I mean, that is such a great advantage to be able to go to one place and seek treatment. Talk to me, though, about your team here and how they work together.
Well, if a patient comes in, let's say a patient comes in with neck pain, we would do a thorough evaluation, including an exam, history. We would do diagnostics such as x-rays, muscle testing, range of motion testing, gait, etc., posture analysis. Once we determine that that patient is someone that we feel we can help, we then put them on an integrated plan, which would include one or more of the disciplines or tools, if you will, in our toolbox. So we would start with, again, something as conservative as massage, physical therapy techniques, acupuncture, chiropractic, and then if necessary, we would do joint injections or trigger point injections or prescribed medicines.
I mean, it really makes sense, but for our viewers, financially, how does it all work?
It's a great question, and it's a question we get obviously every day. Most of the disciplines that we use are covered by insurance. Obviously the medical is, the therapies that we do are. Most insurances cover chiropractic now, and many are starting to cover acupuncture. So when a patient comes in, that's one of the first things that we go over and establish what the financial responsibilities are going to be. And we have very aggressive payment plans for those patients that are self-pay or don't have insurance.
Okay. Well, we're really excited to have you here, Dr. Joseph Haven, because you will be, along with some of your partners here, joining us in future episodes of Primetime Seniors to get into more details about what you do here, how we can better take care of ourselves. So we really appreciate it. Thank you so much.
Thank you.
Stay with us. When we come back, we're going to let you know about the Buford Jasper Active Adult Challenge. But first, we have more tips with Debbie Morris of Home Helpers.
Our Primetime Seniors